34-year-old. Am I a candidate for lower blepharoplasty? I've had bags under my eyes since childhood, no matter how much sleep I get, what I eat, etc. I'm not sure whether that profound of a genetic bag, bulge, can really be addressed with blepharoplasty.
Thank you for your question. You're 34 years old and you state that you've had eye bags since childhood. And so you're asking, are you a candidate for blepharoplasty? Well, the short answer is yes. When I look at your photos from the front view and the side view, it's clear you have what we call lower eyelid fat prolapse. Lower eyelid fat prolapse certainly can happen since childhood. A lot of our patients will say they remember having bags even when they were little kids and teenagers. So having these bags under your eyes will clearly not go away on their own. So addressing those fat pockets can really make a big difference on your appearance. And so how to address those bags is important. It is critical that the character of your face remain at the same and that you just look like you don't look tired anymore. With most patients your age and males, we perform what's called a transconjunctival lower eyelid blepharoplasty. Transconjunctival lower eyelid blepharoplasty, which is a mouthful, is essentially an approach to address fat pockets from the inside of the eyelid. What we're doing is we're getting to the fat pockets, reducing them and repositioning them so that the appearance externally is as if you never had the bags to begin with. The procedure is done under local anesthesia with light sedation in our facility, and we're able to get people back to work in usually less than a week. I'm always impressed at how quickly people are recovering and how minimal the amount of bruising and swelling that the majority of our patients have. And that basically has to do with the protocols that we've developed over time. I've been a practicing cosmetic oculofacial plastic surgeon for over 20 years, and I've always been focused on natural results and quick recovery. So again, to answer your question, yes, you are a candidate, but choosing the right type of surgery for you is very, very important. And so that being said, my suggestion is to have this performed as a transconjunctival inside the eyelid approach, as opposed to, I should differentiate from a transcutaneous or an external approach where you would have an incision line under the eyelashes. But for most young people and young men, there's no reason to do that. We find that they don't have extra skin, so why create an incision on the outside? So I would advise that you meet with experienced cosmetic surgeons who focus a lot on eyelid surgery. I'm a firm believer as a specialist in specialization. And once you find someone who you're comfortable with, move forward, and I think it'll make a real impact on your appearance. So I hope that was helpful. I wish you the best of luck, and thank you for your question.